Hi there, welcome back to UWorld's question of the day. My name is Samantha and we are back with ECG week. We're on day number 2, so let's jump right in. So the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing, so go ahead, take a look at this ECG strip and drop your answer into the comments below. Let us know what you think. I'm going to jump right to our answer today. Our correct option is option number 1, ventricular tachycardia, or VTAC, as you may have heard this. So VTAC happens when we have 3 or more PVCs, or premature ventricular contractions, in a row. It tells us all of this in our name, ventricular tachycardia. We're having a speed problem with our ventricle. So essentially the ventricle is taking over as the pacemaker for the heart. Again, let's go back to the name tachycardia. We also know that we're going to expect a tachycardic heart rate, so a beats per minute over 100, because 60 to 100 is our normal range of heart rate. But what we're going to see here essentially is a bunch of QRS waves that are irregular. So like the PVCs, our P wave is going to be invisible and buried within that QRS complex, and the QRS interval is going to be wide and distorted, which would mean it be greater than those 3 small squares, which is what indicates that it is a ventricular problem. So we need to treat this right away, since VTAC is a precursor to the life-threatening VFib, or ventricular fibrillation. And remember, we always defib VFib. So again, our correct option is going to be option number 1, ventricular tachycardia. Thank you so much for joining, and make sure to join again tomorrow.